Hi, welcome back to Rohrich Knows Podcast. I'm Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Let's talk about brow lifts. Brow lifts in the past have been one of the most overrated procedures, a lot of work and little to see long-term. But with the advent of Botox, brow lifts almost disappeared for over a decade. But today, let's talk about baby brow lifts. They're back, BBB. And 5 key techniques from non-invasive to surgical that you should think about. And I think that's very important because so much of the time when you're looking at eyelids, you really need to also evaluate the brow. And because the brow and the eyelid go together. And that's very important because sometimes you may not only just have redundant eyelid skin, but you may have brow ptosis. So you can't fix one without fixing the other. And that's I see that not uncommonly done, and then the eyelid is overdone and they can't close their eye and they look different or weird. And that is a very challenging look to correct. So what are these 5 techniques? Well, let's start with the simplest. It's not necessarily simple, but it's the Botox brow lift. And really, over 20 years ago, with the advent of a neuromodulator called Botox, you could relax the muscles in the brow, and actually those on the side, the antagonistic muscles, the orbicularis oculi muscle, and that was the antagonist muscle for the brow elevation, and you could really correct brow asymmetry and brow ptosis, temporarily, of course. So this is a very powerful technique. It's using the power of a neuromodulator to soften the brow and also to allow the muscles to relax in the eyelid so that the brows would go up on the outside. It requires finesse technique, as you can see in this lady that had neuromodulators in specific areas, especially in the upper forehead and glabellar area and the lateral canthal area, and gives her a natural looking brow elevation that looks very good and not surprised. And I think that's the most important thing. Here's another example of that with the frown lines, the 11s. And of course, you know, famous brow lifts from Botox, including Bella Hadid, is basically just allowing the elevation of the lateral brow, which opens up the eyelid as well. And I think that is a very powerful technique, minimally invasive. Now, another thing that I don't do and I think you shouldn't do is thread lifts. These are these absorbable threads that have been on and off throughout the last 15 years being used where they're threading tiny barbs in through the skin and into the brow area. And these theoretically dissolve and then they produce collagen around them. The problem is this is one form of that, and then the other form is that of truly using barbed sutures and then elevating the brow. And the problem has been infection, asymmetry, and really lack of result that you can see. They may look good on the table or for a week or so afterwards, but they really don't look good long term. And then if they do have a problem, you can get an infection, you have to take them out, and you can get a scar deformity. So I would say this is a no-no. I would not do a thread lift. That just doesn't look good. So another very common thing that's often neglected is the forehead. The forehead ages just like everything else. So I use fillers, especially in the lateral brow area, to allow for rejuvenation of the brow, because so many times it's not brow ptosis, it's loss of dermal and fat tissue in the brow area. So when you fill that area, it actually supports that volume and gives you the illusion of elevating the brow. Very natural, very powerful. I do this in most facelifts. As you can see in a patient like this that has brow rejuvenation just from a filler. Again, this is a patient with a filler, and then this is a patient of mine that I had a forehead fat filler in the glabellar area and the temple area, just in conjunction with a facelift, and gives you a natural looking look. Another patient, same thing, fat rejuvenation by softening the lines, also bringing up the eyebrows. These are very powerful techniques and technologies. Now, Other technologies that have been shown and used to bring brow elevation 1 or 2 millimeters is ultrasound and radiofrequency technology. Both work reasonably well by stimulating collagen production and causing the skin to contract and tighten. And it does produce a gradual lifting and firming in the brow area. Minimal to no downtime. There is some discomfort, however, and some proponents say it lasts up to a year. All I can say is that it does work, but there's some discomfort because you're doing radiofrequency microneedling or ultrasound waves in this area, and it does cause you to have some discomfort. Here's an example from one of our patients at the epicenter with radiofrequency microneedling. Really nice shaping of the eyebrow. Here's my nurse practitioner. Really nice shaping not only of the eyebrow but also the neck with another technology called Evoke. And then soft wave is another ultrasound technology that really helps in eyebrow shaping and also neck contouring. So these are all techniques and technologies that do work, but they give a very subtle improvement. So we've gone from the minimal to modest to now what I would say is invasive. And today, no one hardly ever wants or needs a true hairline or transcoronal brow lift because of the scar and the numbness, which can be permanent. But I have found a real niche for limited temporal brow lifts, which is an incision that goes into the hairline, into the temples, and it allows you to elevate the lateral brow and the lateral part of the eyelid. And I think this is a real finesse procedure. Recovery is usually about a week or 10 days, and I do it often with a facelift, such as I did in this patient. So you can see the markings for the brow lift are hidden into the hairline and also up into the scalp. It elevates the lateral brow in these areas. It helps to shape it and contour it. It really does a beautiful job in this area. And you can see it in patient after patient that like this, that looks really, really dramatic and very nice. Again, the use of combination techniques of temporal brow with facial fat augmentation. So baby brow lifts are back. Patient selection is key. And what is the goal? Make sure that when you are considering eyelid rejuvenation that you don't forget the brow, because if you have brow ptosis, you can't fix it with eyelid surgery or blepharoplasty. But what we've learned is minimally invasive, and then the limited lateral temporal brow is a very powerful and a useful technique, and it has a long-term positive effect. And the most important thing is know before you go. Talk to a board-certified plastic surgeon or facial plastic surgeon that has expertise and understands facial aging and can do all of these techniques and is very familiar with these technologies. And then, and only then, will you be able to get, I think, a very good and safe outcome. So give me your comments, give me your thoughts on baby brow lifts, and let me know what else you'd like to talk about in the area of facial rejuvenation. So until next time, helping you become a better you.